Welcome to Case Management and Social Work Magazine Show. I'm your host, Linda Del Bosque. Today we'll be speaking with CMSA Chicago, John Heraty, President-elect, regarding House Bill 1459.
Doing great, Linda, and thanks for having me.
Of course, John, one thing that we'd definitely like to speak to you about today is the level of advocacy that CMSA Chicago brings to the table, especially on the Nurse Licensure Compact, Illinois House Bill 1459. Tell us more.
Okay, thanks, Linda. So it's the House Bill 1459, and it's called the Nurse Licensure Compact, which basically allows, let's say we're talking about an Illinois nurse, that it allows an Illinois nurse to not only have a nurse license in the home state, but also in the 34 states that are part of the Nurse Licensure Compact. So it's basically they would be able to get a multi-state license.
And why is this very beneficial for nurses? Why would this benefit case managers?
So think about it. If you if you're a nurse in Illinois and you only have one license, that's all you can do is you're only licensed to practice in the state of Illinois. Now think about if you had a license to practice in 34 states. In some ways, you're 34 times more marketable. And with the telehealth, telemedicine, federal, local, everybody's talking about telemedicine. It's coming out of the closet a lot more. Nurses in Illinois will be able to do like some of our border state nurses, Kentucky, Indiana, who's just going to be able to start July 1st with the Nurse Licensure Compact. They'll be able to practice in 34 states. Hopefully one day Illinois will be.
Okay, is this the first time this has been brought up to our representatives to be passed to and advocating for this for our professional nurses?
It's been going on for about 10 years, and two of my colleagues, Colleen and Eric, Colleen the president, Eric the past president, they've been around CMSA much longer than me, and they laugh and say, we've been trying to get this passed for about 10 years. So, Linda, I think it's about 10 years already that they're trying to get this passed.
Okay, and why is CMSA so passionate, CMSA Chicago so passionate about advocating for case managers and social workers on this level? What I understand the advocacy is part of a service line of CMSA Chicago, but why is it very important and why do you keep tackling it for the past 10 years?
Right, okay. So I would say it's at least a three-legged stool. It's the patients, right? We hear so much, and even in Chicago where we live, you and I, Chicago suburb, is Mayor Lightfoot rightfully keeps talking about healthcare disparity, zip code disparity, a disproportionate amount of brown people and black people that are unfortunately passing away. You have in big health insurance companies too. It are recognizing the fact that people have a much better chance of dying or becoming ill or not having access to healthcare based upon where they live. Telemedicine levels the playing field. So as a nurse, if you want to reach out to the state of West Virginia, they just passed the Nurse Licensure Compact. You talk about physical distancing. These folks a lot of times have barren resources, and at least they have access to telemedicine in 34 other states where they're not just dependent upon places that are far away. And so that's the patient perspective. There's a lot of patients that have mental health challenges, maybe agoraphobia, a lot of anxiety, a lot of depression. They just don't want to go out. Some people just personal convenience. It's like, hey, if I can get this done at my house in the comfort of my house, why can't I do it? I don't have access to transportation. I'm physically limited. So from a patient perspective, there are so many benefits. from a nursing perspective, one of the examples I give is a lot of our nurses, even in Case Management Society of America, you know, they're brilliant minds. They're 40, 50, 60s, maybe 70s, maybe some are in their 80s. These are vibrant nurses. Nurses that have had a double knee replacement or a difficult hip and still a beautiful brain. The state of Illinois is basically saying, hey, unless you go to the front lines and meet people face to face, or you only telephone people in Illinois, we're not going to let you use your beautiful brain and your beautiful nursing skills or we're going to force you to get an individual license, pay a lot of money, Indiana, West Virginia, wherever else you want to work. So and it's not a dirty word. How about helping business? We're losing so many citizens of Illinois, so many businesses. Don't you think a business wants a nurse who's all loaded up with 34 licenses instead of one singular license? Mm-hmm. So 3 things. We want to talk about patient benefits. We want to talk about work, employee benefits, nurses, and business, and not apologize for it.
One person find out in the healthcare industry, or case managers, or professionals, healthcare professionals, find out more about this House bill? Is this something that you host on a CMSA website, or is this something they can look up through our state tracker?
Great. We have recently, Colleen, Eric, and I have did a presentation to all CMSA membership nationwide, had a real nice attendance, and the 3 of us just did it yesterday, Thursday, May 14th, to the Indiana chapter. One of the best ways to do it is to go to CMSA-Chicago.org, or just CMSA Chicago. You'll see us in there. We've got contact information. But I would say probably the very best way is simply to go to ilga.gov. IL for Illinois, GA for General Assembly.gov. And this is like a federal thing. So Indiana is like I.in.gov. So it all kind of follows the same code. And then it's an easy website to look at. You can go on there and search by legislator. If you want to look up a particular representative, you can type in HB, which stands for House Bill 1459. And quite frankly, you might say, you know what, my heart is just not in the Nurse Licensure Compact. If your heart is in other things, still go on there and search for things that you're interested in.
Perfect. Thank you. I appreciate it. We're also going to host this information and video off our website as well. We'll also make sure that CMSA Chicago, we have that information linked directly to your website. So we need to contact our state representatives currently right now. Is that correct? Is that a number one thing, an active call for action?
Yes, very good. So I'm glad you brought that up. And one of the things that Eric Bergman, past president of CMSA, very involved on the national board, he talks about the circle of influence. And so in other words is, if somebody wants to make a change, but they just do it themselves and they send an email, or they forward an email template that's kind of already in the can and not personal, that has a limited impact. Or if they make a phone call, it has a limited impact. But all of a sudden, if you start gathering friends and have a group of friends, or like at our conference in March, early March in Oak Brook, we had a call to action where everybody got out their phones and they could personalize the template. So you might have 300 people sending a personalized message to that person's representative. I do want to give a plug for a website called nursecompact.com, nursecompact.com. That is through a nonprofit, the National Council for State Boards of Nursing, and they are one of the principal advocates of getting the Nurse Licensure Compact passed all across the country.
Oh,
So, John, what is one thing that we can really do to champion around this House Bill 1459? Could you give us some advice if we keep trying and trying?
And I kind of joke, if you won't let me go through the front door, I'll go through the back door. If you won't let me go through the back door, I'll go through the window, kind of thing. And I think that the metaphor is that if you feel like an Illinois representative isn't calling you back, or an Illinois senator, or you think somebody should be getting back to you, keep persevering, because you never know who the next person you pick up the phone to call. And I can tell you this, I recently talked to a senator from Indiana named Ed Cleary, Clery, who is the author of the Nurse Licensure Compact in Indiana. He opened it up as far as how they were able to get the Nurse Licensure Compact passed in Indiana. So what I want to do is I want to talk to Anna Mueller. I think that's she's one of the chairpersons of the Health Licensure Committee, and say, hey, I got this great contact in Indiana who already got it done. You, as a representative from Illinois, you're trying to get it done. Can the two of you get together? So, and Ed clearly also told me is you just got to keep persevering. So that's a message I really want to get across.
well, this could be the year, John. 10 years in the making. This could be the year.
Right, and with COVID-19, the senator from Indiana, or the representative Cleary, said, John, it's funny in a way, because this is almost a moot point right now, because Governor Pritzker, my understanding, says, hey, do all the telemedicine you want right now. Do all the Nurse Licensure Compact, because we're in a state of emergency licensures for everybody. And so when you do things seat of the pants and everything's an emergency, if we had Nurse Licensure Compact, we could have hit the ground running on this thing.
Advocacy. And so tell us a little bit more about CMSA Chicago before we leave.
Right. So it's a professional association. An association is a group of like-minded people, right, that have a like-minded mission. So it's a nonprofit. It's associated with the national. We have chapters all across the country. But with CMSA Chicago, like many of our sibling chapters, really it's comprised, I would say, about 75% nurses, maybe about 10% social workers in Chicago, and then kind of others. We really get a lot of support from our small businesses. They sponsor different things across the continuum of health. But like many associations, Linda, it's all about educating, continuing education. We offer a lot of continuing education, and so much is about professional development. Even, I'm a clinical member-facing social worker, but I really feel like I get a lot of executive level skills training through my work with CMSA Chicago. So I would say education, networking, and professional development are the top three things that come to mind for anybody that decides to join us.
And I've actually attended one of your conferences here, and I think they're wonderful. I mean, I was really floored by the level of support you have on multi levels, from the small businesses and also the hospitals, the hospitalists, and how many members are currently right now a part of CMSA Chicago?
We have right around 400, maybe just a little bit more than that.
Well, congratulations. And how long
Thank
have
you.
you been on the board?
I've been on the board 3 years.
And you're now going to be president-elect. So when does that begin? When does the term?
I've been president-elect for just about a year. Colleen Morley's the president. And then the plan is for next August 2021 for me to take over as president.
Okay, well, good. I look forward in working with you and continuing paving this path. And thank you for being a guest on our show today.
Thanks, Linda.
Thanks, John. Have a good day.
You too.